different aspects of vision.
Animation shows two eyes connected by a pathway to the back of a brain.
One of these pathways is the evolutionarily new pathway, the more sophisticated pathway, if you like, that goes from the eyeball through the thalamus to the visual cortex of the brain. Now, you need the visual cortex for consciously seeing something.
In his car, Ramachandran sits at a railroad crossing. His surroundings are blurry, then become focused as a trolley passes.
The other pathway, which is older evolutionarily and is more prominent in animals like rodents, lower mammals, birds, and reptiles, goes to the brain stem, the stalk on which the brain sits. And from the brain stem gets relayed eventually to the higher centers in the brain.
Animation shows two pathways connecting eyes to a brain.
Specifically, the older pathway going through the brainstem is concerned with reflexive behavior, orienting to something important in the visual field, making eye movements, directing your gaze, directing your head towards something important. In these patients, one of these pathways alone is damaged, the visual cortex is damaged. And because that's gone, the patient doesn't see anything consciously. But the other pathway is still intact. And he can use that pathway to guess correctly the direction of movement of an object that he cannot see.
Now at a zoo.
Graham's vision is similar to that of reptiles, who depend on unconscious blind sight for their survival.
A lizard, if it wants to catch a fly, for example, doesn't actually have to see a fly, it doesn't have to recognize a fly, it just has to be aware of something moving. So I suppose me and the lizard are distant cousins.
A lizard nods its head.
One of the goals of neuroscience is to understand which parts of the brain are dedicated to what function, how different mental capacities map onto different pathways and different neural circuits in the brain. And surely this fascinating syndrome is going to help us understand not only the nature of seeing, not only the division of labor between these different pathways, but the question of what is consciousness? What does it mean to be consciously aware of something? Why is one pathway alone conscious, whereas the other pathway behaves like a zombie that's trapped inside him, that's unconscious? The syndrome is so strange that when it was initially reported, people didn't believe it, and there are some people who still don't believe it. But in a sense, it's not that strange if you think about it, because in a sense, we experience blind sight all the time in our daily lives. For example, as I am driving this car and having this conversation, all my attention is on the conversation, on the person next to me. And in fact, I'm not conscious of what's going on around me. Even though I'm negotiating all this traffic, avoiding obstacles, avoiding that car on my right, avoiding the car on my left, that's all being done in parallel by another part of my brain, and it never emerges into conscious awareness unless something very strange happens, like a big truck passes by, I might notice it.
Ramachandran glimpses a skateboarder to his right.
Blind sight enables us to steer our way successfully through the world, as if on autopilot.
How are we on the right side? Oops.
Without this zombie in our brains, we'd be swamped by visual information, unable to focus on what really matters.
Ramachandran drives into a dark tunnel. Now in a lab, an elderly woman draws on a piece of paper.
Unlike Graham, Peggy Palmer has normal vision.
No, she's not bad.
She should be able to copy this star easily.
I'll never get this star. I'm hopeless at this.
But something odd is happening. One whole side of the star is missing. Peggy has a condition called visual neglect. Although her eyesight is fine, half of her visual world no longer seems to matter. 10 years ago, Peggy suffered a stroke in the parietal lobes of her brain.
The parietal lobes are concerned mainly with creating a three-dimensional representation of the spatial layout of the world, allowing a person to walk around, to navigate, to avoid bumping into things.
Ramachandran walks in a hospital.
When the right parietal is damaged, the patient is unable to deal with the left side of the world.
This condition has fascinated neurologists for more than a century because it reveals not only how the brain shapes the way we perceive space in the present, it even determines the spatial look of our memories. This became apparent when Peggy was asked to draw a daisy from memory.
A man watches Peggy draw.
Right. A daisy it shall be.
For neuropsychologist Peter Halligan, Peggy's drawings reveal exactly what's gone wrong.
It's like a radar system, whereby the actual radar system on the left-hand side is no longer working well. If someone comes in on my left-hand side now, or I hear a sound, my eyes will immediately move to the left-hand side. That makes me, for evolutionary purposes, very aware of my environment. Because if I wasn't aware of those things, I'd have accidents. I'd get hurt, or I might get eaten by wild animals and whatever. Now, in Peggy's case, she will not attend to those things that we would normally be aware of.
Peggy thinks she's drawn her daisies right, until it's pointed out to her.
You've noticed that, have you?
Oh dear.
So what Peggy's drawn for us is several nice daisies with the left side missing. Same with this one, and this one. And look at this one, this is a very good example.
I've done it on all of them.
Which means that she's not only neglecting events in the world, but when she conjures up a mental image, she's ignoring the left side of that mental image.
Well, I thought I was going all the way round, you see.
And this shows you that this is not simply a sensory problem, but a problem of consciousness.
I don't know. It's because I was so concentrating on that side. It takes everything away, you see. It's his attention, really. It's taken away. There must be two attentions somewhere in your body. That one side's taking the other one away. I can't make it out at all. Very odd.
In a garden, Peggy sits in a wheelchair holding a real daisy.
Peggy's one-sided daisies graphically reveal how damage to the visual centers can warp our consciousness of the world, and how complex the human visual system actually is.
Now at an outdoor mall.
When I was a medical student, I was taught there's an area in the back of the brain called visual cortex, and that's where seeing takes place. But since then we have learned, in fact, there's not just one, there are 30 areas in the brain concerned just with seeing.
Ramachandran passes numerous shapes and colors.
For Ramachandran, a walk through this Southern California mall shows exactly what these visual areas have evolved for.
And maybe these different areas are specialized for different aspects of vision. One area for seeing colors,
Red balloons,
another area for seeing movement,
an airplane,
for form and shape,
shadows,
relative distance and depth. Now, despite this staggering complexity of all these different areas, there seems to be a simple overall pattern of organization. In fact, the visual input as it comes in seems to divide into two parallel streams of processing. There is one pathway which we call the how pathway, to which some of these areas belong, and that how pathway seems to be concerned mainly with navigation, with being able to walk around, avoid bumping into obstacles, avoiding uneven terrain, reaching out and grabbing something.
computer animation.
The how pathway leads from the main visual areas to the parietal lobes at the top of the brain, where Peggy suffered her stroke.
Two lobes stem from the visual cortex at the back of the brain.
The other pathway, the what pathway, leads from the main visual areas to the temporal lobes, located just behind our temples.
The what pathway is concerned with recognizing the object. What am I looking at? What does it mean for me? Is this an edible object? Is it a flower? Is it a person's face? What is it that I'm looking at, and what does it mean for me? That's what the what pathway is concerned with, and it's that pathway that seems to be damaged in David.
Now David, a young man, stares at a face on a computer screen.
David presented Ramachandran with one of the strangest cases he has ever encountered.
David rides in a car with his father.
2 years ago, David was involved in a terrible car accident while driving back to California from Mexico.
There was a problem with the car, and I landed in the highway with my head first.
Okay.
Now, outside his parents' home, David waves at a passing truck.
For 5 weeks, David lay in a coma. Serious injuries led to the loss of his right arm. But to everyone's relief, when he regained consciousness, his mental capacities seemed to be intact.
He was articulate, he was intelligent, not obviously psychotic or emotionally disturbed. He could read a newspaper. Everything seemed fine, except he had one profound delusion. he would look at his mother and he would say, "This woman, doctor, she looks exactly like my mother. But in fact, she's not my mother. She's an imposter. She's some other woman pretending to be my mother."
The injury to David's brain had brought on a very rare condition called the Capgras delusion.
David's mother.
I was cooking dinner, and he probably didn't like the food that night.
Okay.
And he said, "You know, the lady who comes in the morning, she cooks much better than you.
Okay.
It's that lady, I like that lady very much."
Okay.
But the lady was me, of course, all the time.
David was also convinced that his father was an imposter.
He would say to his dad, "You know, I'm sure you would like to meet this guy. He's so much like you, but he drives better. He doesn't go so fast."
David.
It can look identical to him, exactly like him, but it's not him.
After 2 months of this disturbing behavior, David's parents decided to seek help from Ramachandran.
But when you looked at the person who looked like your father, what was your feeling? Did it look like there's some other person who resembles your father? Is not really your father, something like that?
Exactly. There's a difference of the fact that I know that that person happens not to be my father.
Uh-huh.
It is not my father or my mother, right?
Okay.
I don't expect things from that person as I would expect from my parents.
David sits between his mother and father at a table laid with cheese and fruits.
David not only had delusions about people, he also believed that the house that he lived in was just an imitation of his home.
One day he started getting really angry. "I want to go to my house. I want to go to David's house. I want to go to David's house." And we're in the apartment. And I'm just going, what am I going to do? So I decided, I said, "Okay, David, let's go." So I took him down the stairs.
She reenacts the story with David.
And I went around through the back, came back through the elevator, took him to bring, the same apartment. And I said, "This is your house." And I opened the door and I said, "Okay, ciao." And I just left him there alone. It was the same apartment. And he looked at it and said, "Oh, yes, this is my apartment."
David stares at his parents.
Things like that would happen.
Right.
And then maybe a few days after, he would start saying, "I want to go to my house. David's house. This is not David's house."
Amazingly, David sometimes referred to himself as the other David, as if his own self were an imposter.
The Capgras delusion has been known since the turn of the century, but has been treated as a curiosity, an anomaly. The standard explanation, which you find in most psychiatry textbooks, is a Freudian one, and the idea is something like this. This young man, like most young people, when he was an infant growing up, he had strong sexual attraction to his mother, the so-called Freudian Oedipus complex.
David talks with his mother.
I talked to him and I said, "He cannot evaluate me because I'm not playing." He said, "Wait, you evaluate your work for what?"
But then along comes a blow to the head, and suddenly and inexplicably, these sexual urges come flaming to the surface, and he finds himself sexually attracted to his mother. And he says, "My God, if this is my mother, how come I'm attracted to her? How come I'm aroused? This must be some other strange woman." Now, this is an ingenious explanation, but it doesn't quite work. Because I've seen a patient who has the same delusion about his pet dog. He'll look at his pet dog and say, "Doctor, this is not Fifi. It looks just like Fifi, but in fact it's been replaced by another identical dog." So how does the Freudian explanation account for this? Unless you start talking about the inherent bestiality in all human beings or something like that. So what really causes the Capgras delusion? Well, it turns out that when you look at an object, the message goes to the temporal lobes, to the visual centers in the temporal lobes. But seeing is a multi-level process. After you've recognized it, you also need to respond to the object emotionally. This is obvious when you look at a Picasso or a Rembrandt or any beautiful picture. Even when you look at, say, your mother's face, the appropriate emotional warmth has to be evoked. Or when you look at a lion, you have to be afraid. And all of this is part of the visual process, but happening in a different part of the brain.
Now in the computer-animated brain.
Whenever we look at an object or a face, the message reaches the temporal lobes, where it's identified. But then it gets relayed to a structure called the amygdala, which is the gateway to the limbic system that contains the emotional centers of the brain. And it's here that we generate the appropriate emotional response to whatever it is we're looking at.
Now, what I've suggested is that what's going on in this patient is the message gets to the temporal lobe cortex, so the patient recognizes his mother as being his mother and evokes the appropriate memories, but the message doesn't get to the amygdala because the fibers going from the temporal lobe cortex to the amygdala and to the emotional centers are cut as a result of the accident.
The amygdala, which runs through the temporal lobe, breaks.
Therefore, there is no emotion, there is no warmth. And he says, if this is really my mother, why is it I'm not experiencing any emotions? There's something not quite right here. Maybe she's some other strange woman pretending to be my mother.
Ramachandran's hunch that David's delusions were being caused by the rupture of specific brain circuits was lent unexpected weight when David's mother recalled a breakthrough with the phone.
David talks with his father on the phone.
We got so tired of him saying, you're not my dad, you're not my mother, you're my mother. We decided, okay, you go downstairs, call on the phone and said, David, hi. And on the phone, he would know he was his dad. On the phone, he never, ever
Had this problem. So on the phone, he'd always recognize
on the phone
as his father.
As his father, no problem.
When he saw him in person, he would say, you look like my father, but you're not really
my father. No.
This shows the patient is not crazy. Why would he be crazy in person but not on the phone? The answer is there's a separate pathway that goes from the auditory cortex, the hearing part of the temporal lobe, to the amygdala. And that pathway was not damaged in David by the car accident. Therefore, when he listens to his father on the phone, there is no delusion.
David uses the phone.
This is a lovely example how you can take a completely bizarre neurological syndrome, maybe from the X-Files of neurology, which no one really understood, a person claiming that his mother is an imposter, and then come up with a very detailed explanation in terms of the known anatomy of the brain, saying, here is where the flaw is, and then doing an experiment that takes just an hour to do.
So this first one's...
And showing that this is what's gone wrong in this patient.
David sits at a computer with electrodes attached to his palm.
To test his theory about the Capgras delusion, Ramachandran arranges to measure David's galvanic skin response, which is the basis of the lie detector test.
David looks at his father's picture.
If David's brain were normal, he would react emotionally to this picture of his father. This in turn would stimulate an almost indiscernible increase of sweat on his skin and a heightening of electrical resistance that can be measured.
A graph shows a peak.
The prediction is that when people with normal brains look at photographs of people they don't know, they will not respond emotionally. So there will be no change in skin resistance. But a familiar face will prompt an emotional response, and invariably there is a change. Now the question is, what happens with David? If Ramachandran's theory is correct, pictures of his parents will not evoke an emotional response, so the line should remain flat.
David looks at his mother's face on the computer screen. On the resistance graph, the line remains flat.
Now, this is also telling you about how all of us, how normal people, respond to faces and to objects, because what happens in this patient is truly extraordinary. The lack of emotional response actually leads him to this very profound delusion that this person is not really his mother. In other words, the lack of the autonomic gut reaction, this emotional response, leads him to an absurd conclusion, overriding what his intellect is telling him. And this tells you how closely linked your intellectual view of the world is to your basic emotional reactions to the world.
In his parents' kitchen, David smiles and eats as his mother walks by.
Luckily for Capgras patients, the condition seems to heal itself. David no longer thinks his mother is an imposter. And the man who looks like his father is his father and triggers the flow of all the old familiar feelings. David's lack of emotional response showed just how crucial emotions are to the recognition process of the normal brain.
Now tall cliffs overlook the ocean. A young man stands on an observation deck atop the cliff.
But what would happen if the emotions were to run out of control? What effect might an excess of emotion have on the way we interpret the world?
The man squints as he stares out.
John Sharon has temporal lobe epilepsy.
The seizures involve my person and my soul and my spirit, all of it. When I get one of those feelings, though, my whole body just tingles and just, I'm like, that's that.
In a bar, John plays pool.
John's epileptic seizures are essentially an electrical storm in his temporal lobes, when a group of neurons starts firing at random, out of sync with the rest of his brain. Recently, John experienced one of his worst episodes to date. He'd gone out to the desert with a girlfriend, and they'd